Here at ProMotion, we work with a variety of different athletes of all ages in terms of the coaching and training here.
The ideal clinician for us is both a physical therapist, athletic trainer, the dual student who then becomes the dual professional, who understands the competitive spirit and has had exposure to the athletic environments and can apply those principles to anyone across.
We work with all the high schools and recreational leagues in the area and work with all age ranges here.
With Brad specifically, and then we now have a second PT-ATC dual from Shenandoah University. This group of clinicians and practitioners bring to us is a higher level of a skill set. And you know, we had the company just be physical therapists only, which was fine, and that's on the rehabilitation side. But when we're trying to meet the prevention and maintenance goals, there we need a different skill set for someone who really understands SFMA or FMS, which are kind of mnemonics for a way of evaluating movement better. They've determined to go down that path. And then Brad also is very interested in the tactical athlete, where it's fireman, policeman, or military. So he has a passion for that particular industrial athlete, if you will.
Depending on what issues the patient is having, I'm going to typically break them down with a sort of total body movement analysis, and then from there I'm going to develop a treatment program for them to help them get back to their goals. And then there of course are people that just want to get back to being able to go to their job and be able to walk and be able to get through their day without pain. So with regards to patients, that's what I'm working with. In terms of coaching, we're here to really get people sort of bigger, faster, stronger. We're not necessarily going to get you better at running a route in football, but we're going to get you faster on the field, we're going to get you more explosive, and we're going to get you to change direction faster. In high school, I wanted to be an athletic trainer, so I was actually going to go to a different school, but then I found out that Shenandoah offered an AT-PT dual degree. I found out that you could actually get pre-admit into that so that you could do your undergraduate degree in 3 years and then move on. So I got my bachelor's in kinesiology with a focus in exercise science, and went straight into grad school, where I got to learn all kinds of stuff about not only rehab, but then with athletic training you got sports emergency care medicine, and also some more advanced strength and conditioning principles to just help get people back on the field and back to their sports. There's multiple clinical rotations that I got to go on. That's the great thing about the dual program. I did clinical rotations at a variety of places, from local high schools here, in hospitals, and there I got to learn a lot of different things that I would never even dream of working with. And then I got incredible opportunity to go to Florida and work at a company called Exos, where I got exposed to some really elite performance training. I highly recommend Shenandoah University, because not only do they have the opportunity of the dual program, which I personally think is incredible, but their programs on their own are extremely elite and excellent programs with some of the greatest clinical opportunities that really any school is going to offer you. And Shenandoah is the only place that you're going to get them both at the same time, and you're also getting some of the best education in the country.